Radius. The radius is a long bone located in the lateral side of the forearm. It consists of an upper end, shaft, and a lower end. Upper end. The upper end articulates with the lower end of the humerus and ulna. It consists of the head that is shaped like a disc. Its upper surface is circular, concave, and articulates with the capitulum of the humerus. The medial surface articulates with the radial notch of the ulna. A ligament is attached to the articular circumference of the head known as the annular ligament. The neck. It is the constricted part below the head. It is also surrounded by the lower part of the annular ligament. The radial tuberosity is located just below the medial part of the neck. Shaft. It is narrow above and broader below. It has three borders, interosseous, anterior, and posterior, and three surfaces, anterior, posterior, and lateral. The interosseous border is sharp except in its upper part. It extends from the posterior part of the radial tuberosity till the lower end of the radius. The anterior border extends from the anterolateral side of the radial tuberosity and moves obliquely downwards to the lateral side. It is more defined in its upper and lower parts. Posterior border. It extends from the posterior-inferior part of the radial tuberosity till a tubercle at the lower end of the radius. It is well defined only in the middle. Anterior surface. It lies between the anterior and interosseous border. It presents with a nutrient foramen in the middle region which is directed upwards, making the lower end of the radius the growing end. Posterior surface. It lies between the interosseous and the posterior borders. Lateral surface. It lies between the anterior and posterior borders. It is wider in the upper part. A rough ridge is present in the middle of the surface. The lower end. It is broad and expanded. It has five surfaces: lateral, medial, inferior, anterior, and posterior. The lateral surface. It consists of a bony projection called the styloid process. There are two grooves present lateral to the styloid process which transmit the tendons of abductor pollicis longus and extensor pollicis brevis. The medial surface. It has a smooth notch known as the ulnar notch, which articulates with the head of the ulna to form the inferior radio-ulnar joint. A smooth ridge in the lower part of the notch gives attachment to the articular disc. Inferior surface. It is smooth, concave, and triangular. It takes part in forming the wrist joint and is covered by articular cartilage. It is divided into two parts by a ridge. Medial quadrangular part for the lunate and the lateral triangular part for the scaphoid. Anterior surface. It is narrow and thick. It presents with a thick ridge and the capsular ligament is attached below the ridge. The posterior surface is broad. Dorsal tubercle is situated between two grooves and gives attachment to a part of the extensor retinaculum. The medial groove lodges the tendon of the extensor pollicis longus. Lateral groove lodges the tendons of extensor carpi radialis longus laterally and extensor carpi radialis brevis medially. The lower margin gives attachment to the capsular ligament. Determination of the side. The upper end is rounded. The lower end is broader with the styloid process. Lateral surface is convex. The styloid process projects from the lateral side in the lower end of the bone. The bone belongs to the opposite side to which the radial tuberosity points. Ossification. The radius is ossified in three centers, one for the shaft and two for both the ends. Ossification center for the body. It appears in the center at the 8th week of intrauterine life, and fusion occurs by 17 to 18 years. For the upper end, it appears by the 5th year. Fusion occurs by 17 to 18 years. Lower end appears by the 2nd year and the fusion occurs by the 20th year. Clinical correlation. Fracture of the radial head. This type of fracture is more commonly seen in elbow dislocations. They are more common in women. It usually occurs in individuals between 30 to 40 years of age. It is caused by trying to break a fall with your hands where the force travels up your forearm and dislocates your elbow and fractures the part of the radius close to it. A patient with radial head fracture has the following symptoms: elbow pain, swelling at the elbow joint, difficulty in flexion and extension of the elbow, inability to supinate or pronate the forearm. Cooley's fracture. This fracture is located at the distal end of the radius outside the capsule. It usually occurs about an inch from above the wrist. Its occurrence is more in females. Osteoporosis is a huge predisposing factor. It is usually caused by a fall on an outstretched hand. The following symptoms are present: immediate severe pain, swelling, and bruising.